Hello everyone, I am Dr. Sumit. I am a urologist, andrologist, a kidney transplant surgeon at Sanar International Hospital, Gurugram. Today I will be discussing with you the common urinary complaints that a person might have. All the problems of urination, they can be divided into two categories. First category is called storage symptoms. The storage symptoms mean that storage of urine in the urinary bladder has become difficult, and because of which the person goes to pass urine very frequently. Sometimes there is a sudden severe urge to pass urine which is difficult to control. On certain occasions, the urge is so severe that some amount or a few drops of urine might leak in the underpants. One might get up multiple times in the night to pass urine as well. These symptoms, they constitute storage symptoms. The storage symptoms, they can be either because of overactivity of the urinary bladder, also known as OAB. Sometimes it can be because of allergy in the urinary bladder, which is called interstitial cystitis. In elderly men, enlargement of prostate also increase the sensitivity of the urinary bladder, which can lead to increased frequency of urination. Certain diseases like fungal infection as well as tuberculosis of the urinary tract can cause decreased storage capacity of the urinary bladder. Hence, the person would go and pass urine more frequently at a much less stored urine volume. Apart from storage symptoms, the second set of symptoms that a person might encounter are called voiding symptoms. In this set of symptoms, voiding of urine becomes a problem. The person intends to pass urine, goes to the washroom to pass urine, but it is very difficult to initiate the stream of urine. This symptom is called hesitancy. Even when person starts passing urine, he has to apply extra force using his abdominal muscles to let the urine come out of the urinary bladder, and this is called straining. Urine flow might start, but it stops in between, and then again one has to apply pressure to commence the stream of urine, and this happens over and over again during the act of voiding, and this is called intermittency. Even after one has finished the act of urination, one might still feel that the bladder is not empty yet, and there can be persistent sensation to pass urine. The voiding urinary symptoms, both among males and females, can be either because of decreased contractility of the bladder muscles, or it can be because of narrowing of the urinary passage. Decreased contractility of the urinary bladder muscles can happen in patients who have diabetes over a long term. Sometimes patient's nerve can get affected because of prolapse of disc in the back, which can decrease the speed of transmission of nerve signals, causing decreased contractility of the bladder muscles. The obstruction to the urinary tract in elderly males more than 50 years of age most commonly is because of enlarged prostate gland. When the prostate gland enlarges inwards, it causes compression of the urinary passage, leading to decreased flow of urination and both voiding symptoms and storage symptoms. Both among males and females, Narrowing of the urinary passage can also lead to decreased flow of urine. Narrowing of the urinary passage can be because of repeated instrumentation, or if you have undergone some sort of surgery through the urinary tract, or a catheter has been placed in the past. It can cause trauma in the urethra and subsequently narrowing of the urinary passage. Infection of the urethra, also called urethritis, is also a common cause of narrowing of the urinary passage. If you have passed stones in the urine in past while passage, the stone also causes some amount of damage to the urinary tract and can lead to narrowing of the urethra while it heals. So these are the subset of symptoms which an individual can have pertaining to the act of passing urine. Depending upon the age, gender of the individual, the cause can be variable. If you are experiencing any of these problems, please consult a urologist and get yourself evaluated to prevent further progression of the disease and to prevent the pathology in the urinary tract from affecting your kidneys. Thank you.